how to reduce puffy nipples for a male, and he suggested himself, could tamoxifen Nolvadex temporarily help in a low dose?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
The answer to that is yes. When I first entered this business as a competitor years ago, that was bandied about tamoxifen, Nolvadex for bitch tits. And I had a long time ago, way back, long time ago, 30 years ago, I was actually on it at a dose of 10 or 20 milligrams twice a day. 10 to 20 milligrams twice a day. It's a BID drug. It's twice a day. But I didn't go on it because I had, nipple sensitivity. I went on it because I was told, geez, doc, you're on a good dose of that testosterone and nandrolone. Maybe you should go on this because we all suggest you do. So I just followed suit. And I felt, wonderfully dialed in for 20 years on high dose AASs. And I did do for about 10 years of that time, I did do some tamoxifen. Now, here we go again. Tamoxifen blocks estrogen receptors, right? So that kind of throws a wrench in our philosophy that estrogen doesn't really have much to do with gynecomastia / nipple sensitivity. And I manage that now, as I mentioned, with modulating the dose and dosage of my hormonal optimization therapy. So we're back to square one again, where, if it does help improve nipple sensitivity. Oh, by the way, Steve, you and I both know that nipple sensitivity isn't the same thing as gynecomastia.
Exactly.
So let's now interchange the two. When I was at a conference many years ago, a fellow by the name of Dr. Eugene Shippen, who wrote, I think it was a testosterone syndrome. He wrote a book back, it came out in 1998, paperback, and my buddy at the time, Dr. John Chrysler, rest his soul, introduced me to Eugene Shippen. And he told me at the time, he said, yeah, I use tamoxifen, Jeff, to manage some nipple sensitivity early on in my treatments. But he recommended to me a trick to use. He would get a compounding pharmacy to compound about a 5% danazol. 5% danazol in a topical. And good luck finding a compounder that'll do that for you, because it's a one-off drug, and a lot of my compounders won't even attempt giving me a good price on, mixing up a batch of danazol, 5% danazol. But he swore by it. Dr. Eugene Shippen swore that if you get some topical danazol and just, rubbed it on the areola region, it would be absorbed in almost instantaneously, within hours to a day or two, take away any nipple sensitivity whatsoever. So that was his trick. Dr. Eugene Shippen would use topical danazol 5%. I, however, don't use that. I just, as I said earlier, it's been a long time, Stephen. It's been years now since I've used or prescribed tamoxifen. But in my experience, Stephen, it did work. From some of my guys that will come in, Doc, I'm experiencing nipple sensitivity. They write me a short course of tamoxifen, and I would do so. And every time, it took away that nipple sensitivity.
Okay.
Every time.
Okay.
All right.
Thanks.
Welcome.
Maybe one more thing.
Sure.
Low dose, as the patient himself mentioned. What is low dose? What would help, the lowest dose?
Of what drug?
Of tamoxifen.
Oh, well, it comes in 10 or 20 milligrams, I believe, if my memory is correct, but it's a BID dose. So you can either take it 10 milligrams BID or 20 milligrams BID.
Okay.
10 or 20. So I guess 10 would be a low dose, 10 twice a day, higher dose would be 20.
Alright guys, well, do this next. Click on one of these thumbnails to learn a ton more about TRT and hormone optimization. Thanks.